that infections are falling in London and the east of England, but we're still currently seeing infections rise in other parts of the country, and the data does not, as of yet, reflect the impact of people returning to work and school. So we must proceed with caution. Omicron's far greater transmissibility still has the potential to lead to significant numbers of people in hospital. There's already almost 17,000 COVID-19 patients in hospital in England, and due to the lag between infections and hospitalizations, the NHS will remain under significant pressure over the next few weeks. It is encouraging, however, that during this wave, we have not seen an increase in COVID-19 intensive care patients, and there are already early signs that the rate of hospitalization is starting to slow. We know that Omicron is less severe, but no one should be under any illusions. It is severe for anyone that ends up in hospital, and that's far more likely if you have not had the jab. In many major cities in the USA, where the levels of booster vaccination are comparatively lower than the UK, pressures in intensive care are approaching the levels of last winter, and in Chicago, they've already exceeded the peak from last January. So we must remain vigilant and keep fortifying the pharmaceutical defences that we've built, some of the strongest in the world. And today I'd like to update the House on how we're making these pharmaceutical defences even stronger and how we're giving the NHS and this country what it needs to withstand this Omicron wave. Our primary defence is, of course, the vaccination programme. 79% of eligible adults have now had a booster, including 91%, over 91% of over 50s, who we know are more vulnerable to the virus. Per capita, we're the most boosted large country in the world. Data from the UK HSA, which was published on Friday, shows that around 3 months after those aged 65 and over received their booster, their protection against hospitalisation remains at around 90%. These vaccines don't just protect ourselves, our loved ones, but they protect the country's progress too. The reason why we've been able to start the year with much greater freedom than last year, with children back at school, with shops opening their doors, this chamber bustling with activity, is because that so many people have made the positive choice to get vaccinated. Now, there are, of course, a small minority of people who could get the jab, they could get it if they wanted to, but they have chosen not to. And let us be clear, the reasons that those people have also been able to enjoy the freedoms that they have today is because they are standing on the shoulders of those who have come forward, the 9 out of 10 people across the UK who have stepped forward to get the jab. If we are to maintain this collective protection that we have built, we need everyone to choose responsibly and to take the simple step that will help secure greater freedom for us all. Now, people working in health and care look after some of the most vulnerable in our society, and so they do carry a unique responsibility. Last month, this House approved our plans that anyone working in health or wider social care activities that are regulated by the CQC will need to be vaccinated against COVID-19 if their roles involve direct contact with patients, unless, of course, they are medically exempt. This includes NHS hospitals, it includes the independent sector, GP and dental practices, regardless of whether they are working in the public or private sectors. Uptake over the past few months has been very promising. Since the government consulted on this policy in September, the proportion of NHS Trust healthcare workers vaccinated with at least a first dose has increased from 92% to 94%, and we remain committed to putting these measures into force on the 1st of April. Mr. Deputy Speaker, our next line of defence is testing, and we're doing more tests than any other country in Europe. We raised the distribution of free lateral flow tests from 120 million in November to 300 million in December to meet the demands of the Omicron wave. And we're expecting to make around 400 million tests available over the course of this month. That's 4 times the pre-Omicron plan. Mr. Deputy Speaker, our third line of defence is antivirals and treatments, where we've built the most advanced programme in Europe. We've now secured almost 5 million courses of oral antivirals, leading the whole continent in the number that we've procured per person. And we're already making these cutting-edge antivirals and treatments available directly to patients. Last month, we contacted 1.3 million of those at the highest risk from COVID-19, people such as those that might be sadly suffering with cancer or people with Down syndrome. And we sent them a PCR test kit that they can keep at home. If they test positive, they'll then be able to access either a monoclonal antibody or an antiviral, which can then either be sent to, those patients to their home, or they can access it through a clinician at one of the 96 COVID medicine delivery units that now exist across England. We're also making oral antiviral treatments available more widely through a national study. And Mr. Deputy Speaker, any of our constituents that are aged over 50 or between 18 and 49 with an underlying health condition, and if they get COVID-19 symptoms and they test positive, they're all eligible. They can sign up for this trial, if our constituents are interested, by visiting the website panoramictrial.org. The more people who sign up, the more widely we can deploy these treatments. Mr. Deputy Speaker, with these 3 defences, the most boosted, the most tested, the most antivirals, it's no wonder that we are the freest country in Europe. This country is leading the world in learning to live with COVID. And just as we strengthen these defences to keep people out of hospital, we're also taking measures to ensure that the health service has what it needs. As part of this work, we've looked at every available route to secure the maximum capacity possible across the NHS. We've been working with the latest technology to create virtual wards, where patients can be monitored by clinicians remotely in their own homes. We're bringing on stream extra beds in hotels and hospices where people can be safely discharged once they're ready to leave hospital. We're putting in place new Nightingale surge hubs within hospital grounds to provide extra resilience should we need it. And we're making use of the independent sector. This week we announced a new 3-month agreement which will allow NHS trusts to send a wider range of patients, for example those in need of cancer care, to the independent sector for treatment. These measures, taken together, these are our insurance policy, helping us to plan for the worst while we hope for the best. Like any insurance policy, we hope that we don't need to use it. But it's the role of any responsible government to prepare for all reasonable outcomes so that we can keep this country safe and protect the progress that we have made. And finally, Mr. Deputy Speaker, I've always said to the House that any curbs on our freedoms must be an absolute last resort, and that we shouldn't keep them in place for a day longer than absolutely necessary. With this in mind, we've been reviewing the isolation period for positive cases to make sure the measures we have in place maximise activity in the economy and education, for example, but also minimise the risk of infectious people leaving isolation. UK HSA data shows that around 2/3 of positive cases are no longer infectious by the end of day 5. And we want to use the testing capacity that we've built up to help these people leave isolation safely. After reviewing all of the evidence, we've made the decision to reduce the minimum self-isolation period to 5 full days in England. From Monday, People can test twice before they go, leaving isolation at the start of day 6. These 2 tests are critical to these balanced and proportionate plans, and I'd urge everyone to take advantage of the capacity we have built up in tests so that we can restore the freedoms to this country while we are keeping everyone safe. Mr. Deputy Speaker, we've now entered the 3rd year of this country's fight against COVID-19. And thanks to an incredible national endeavour, we're now better protected than ever before. But this virus is not going away. There will be more variants, and no one can be sure what threat they might pose. But we can be sure that our pharmaceutical defences, vaccines, testing and antivirals are the best way to protect our health and our freedoms as we learn to live with COVID. I commend this statement to the House.
West Reading.
Thank you, Mr. Deputy Speaker. I thank the Secretary of State for advance sight of his statement, and I also pay tribute to Professor Sir Jonathan Van-Tam, who has provided outstanding public service throughout the pandemic. It wasn't the government resignation we were looking for, but the timing brought to mind the now infamous and deleted tweet from the UK Civil Service. Can you imagine having to work with these truth twisters? JVT already has a knighthood, but working with the Prime Minister, he must have the patience of a saint. And so on behalf of the whole Labour Party, we thank him for his service and we wish him well for the future. He is truly, Mr. Deputy Speaker, a national treasure. We welcome the announcement the Secretary of State has made on the reduction of the COVID isolation period to 5 days, on condition that 2 negative tests are produced. So let's hope the Secretary of State sorts out testing. Before Christmas, he told us there were no issues with supply, but over Christmas, NHS staff and other key workers were unable to access tests because the government hadn't noticed that the deliverers had shut up shop for Christmas. Workforce shortages are one of the biggest challenges facing the NHS and the wider economy during the current wave of the Omicron variant. This measure will help people get back to work faster and safely. Great news for the Prime Minister, Mr. Deputy Speaker, who through a terribly unfortunate coincidence of timing is isolating today, unable to face the cameras or the public. How good of the Secretary of State to help the Prime Minister back to work in time to face the music again at Prime Minister's Questions next week. The Leader of the Opposition looks forward to seeing him. But what took the Secretary of State so long? Is it really because the government had misread the policy of the Biden administration? How many days does he think the NHS has lost, the economy has lost, because they couldn't read the policy being used in the United States? The Secretary of State has been briefing that it's the Health Security Agency's fault. How brave of him to blame officials. But the CDC advice to the Biden administration is open access and available on their website. Didn't he read it? Doesn't anyone in this government take responsibility anymore? Or is blame the staff now the essence of the ministerial code? Mr. Deputy Speaker, we're not out of the woods with COVID-19 yet. We hope that the Omicron variant has passed its peak in London, but we know it is yet to peak across vast swathes of England and that NHS services are under enormous pressure. Today we learned that NHS waiting lists were at an historic 6 million before the Omicron wave arrived. 24 Hours in A&E isn't just a television programme, it's the grim experience of patients in too many cases. Week after week, we see more evidence of unacceptable delays for patients. And now we know they're lowering standards and normalising longer waits in the NHS. 12 hours to be seen in A&E, 2 years for referral to treatment, and an hour just to be transferred from an ambulance into hospital, assuming you can get an ambulance and haven't been told to phone a friend or call a cab if you're suffering from a suspected stroke or heart attack, as has happened in at least one trust in the northeast of England. Does the Secretary of State really believe these waits are acceptable, or is it just the case with this government that when they break the rules, they change the rules? And Mr. Deputy Speaker, he'll want to blame pandemic pressures alone. But we went into the pandemic with NHS waiting lists already at a record high of 4.5 million, staff shortages at 100,000 and social care vacancies at 112,000. Patients are paying a heavy price with delays and the country has paid a greater price with lockdowns because a decade of Tory policies left the NHS without the capacity and resilience to withstand the annual pressures of winter, let alone the unique pressures of a global pandemic. So where is the workforce strategy for the recovery? Where is the elective care recovery plan? Where is the sign that this government has any understanding of their responsibility, the responsibility they bear for the crisis, let alone a plan to fix it for the future? And finally, Mr. Deputy Speaker, can I ask what on earth the Secretary of State thought he was doing yesterday when he leapt to the Prime Minister's defence? His first duty is to public health. Absolutely. He also has a duty to the health and social care workforce. And if doctors and nurses had brought their own booze to work, they would have been fired. The Prime Minister has undermined trust and confidence at a critical moment in the pandemic. Who is he to ask others to do the right thing when he doesn't practice what he preaches? So, Mr. Deputy Speaker, in conclusion, the Secretary of State has a duty to inoculate the government's pandemic response from a toxic, radioactive Prime Minister. The public have concluded the Prime Minister is unfit for office. The Secretary of State needs to be careful in his defence that they do not draw the same conclusion about him.
Secretary of State.
Mr. Deputy Speaker, well, first I noticed that the right honourable gentleman didn't mention the huge increase since he last stood at that dispatch box facing me that we have seen in booster vaccinations in this country. He just heard me say he knows that we are the most boosted country in Europe, the most boosters of any large country. He knows how much that has helped, and not one word of thanks from the right honourable gentleman to the NHS, all the volunteers, the military, and everyone that helped do that. Not one word of thanks from the right honourable gentleman. Not one word of thanks. It will be noted. It will be noted by the British public. And then I did notice, Mr. Deputy Speaker. I think you've had your. If you want to return to the dispatch box, would you like? I'll sit down. Do you want to return to the dispatch?
I'm not sure that's in order, Mr. Deputy Speaker, but what I did say from a sedentary position is the Prime Minister is not fit to lick the boots of NHS staff in this country.
We won't have that again, please. No interventions like that, please.
Mr. Deputy Speaker, again, he had another fresh opportunity to thank the NHS for the enormous work that they have been doing, not just throughout the pandemic, but in December, especially for everything that they've done to boost so many people, but not one word of thanks from him. But what we did hear from the right honourable gentleman, I was pleased to hear, though, that he welcomed the new self-isolation policy, and he's asked about whether there are enough tests available. He might have heard me say earlier that we've quadrupled the number of tests available this month to 400 million, approximately lateral flow tests, so more than 4 times the original pre-Omicron plan. But I was confused, though, Mr. Deputy Speaker, with his response on that, because he seemed to be suggesting that we should subcontract our COVID policy to the US CDC. If I heard him correctly, he was suggesting that just because another country, in this case the US, have changed their policy, we should automatically follow suit and do what they do. Now, we have just taken back control from the EU. We have just left the European Medicals Agency, and here he is, just months later, suggesting we subcontract our policy to another state. I mean, this tells you all you need to know about the Labour Party's approach to this. And then in suggesting that we take the same approach as the US, he should know of all people that the US might have a 5-day only isolation period, but they have no testing. They have no testing, and I don't know if he heard me earlier, but let me remind him. The UK HSA data shows that approximately 30% of people at the end of day 5 are still infectious. So that's why we require 2 tests. But the right honourable gentleman was suggesting we should have the same policy as the US, which requires no testing, and for everyone to leave isolation at day 5, regardless of whether they've tested or not, and wear face masks for the last 5 days. So I think the right honourable gentleman does have to decide, does he want these decisions made here in the UK based on expert UK advice with some of the best advisors that exist anywhere across the world, or does he want to subcontract it again to another state? And then finally, he talked about the NHS and capacity. He will know that it has sadly been necessary because of the Omicron emergency for the NHS to make changes. Of course, that has had an impact on electives. The most urgent electives like cancer care will be protected. He heard me talk about earlier about the deal that's been done, at least for the next 3 months, with the independent sector, and I hope he supports that. I hope he supports the measures that the NHS is taking to protect capacity.
Select Committee. Mr Deputy Speaker, I welcome today's announcement. We have one of the best vaccine programmes in the world, and as a result of that, we can look forward to a time of living with COVID with justified confidence, and this is a very important step forward. The Select Committee last week, as the Secretary of State knows, published a report on what's going to happen now the NHS starts to think about tackling the COVID backlog. And we said we were worried that it would be derailed by a workforce crisis with shortages in nearly every specialty throughout the NHS. So can I ask the Secretary of State, when is the COVID backlog plan going to be published? Will it have details about what's going to happen in areas like emergency care, general practice, social care, all of which have a direct impact on the ability of the elective care programme to deliver? Will it deal with what the Health Foundation says a shortage of 4,000 doctors and nearly 19,000 nurses necessary for that elective recovery programme? And finally, when is he going to publish a workforce strategy, and will that have independently verified assurance that we are training enough doctors and nurses for the future?
First of all, Mr Deputy Speaker, can I thank my right honourable friend for his support for the changes that the government has announced today. And he's right to raise the importance of workforce, especially when it comes to dealing with the backlog. He may know that since September 2020, there's 20,000 more clinicians working throughout the NHS, but we do need to plan properly for the long term in terms of NHS workforce. The government is working on a workforce strategy, and I look forward to discussing that with him and the members of his committee that he so expertly chairs in due course.
Patricia Gibson.
Mr Speaker, in response to the news that all Tory MSPs and the leader of the Tories in Scotland have called for the Prime Minister's resignation following his COVID rule-breaking party, the Tory leader of the House resorted to personal attacks. Does the Secretary of State for Health think that members of his government attacking those who criticise COVID lockdown regulation violations is conducive to encouraging public compliance with COVID restrictions, with all the implications this has for the NHS and the staff who are already under enormous pressure? And if the Prime Minister cannot or will not follow his own rules, why does the Health Secretary think he can possibly continue to argue that the public should follow these rules? Is it not the case that the Prime Minister's credibility on regulating and issuing public health instructions as we continue to face COVID restrictions is in tatters, and the longer the Secretary of State for Health supports the Prime Minister's breach of these regulations, his own credibility is suffering? Does the Secretary of State for Health truly and sincerely believe that the Prime Minister is the best person within his party's ranks to lead the UK Government's ongoing battle with COVID?
Mr Deputy Speaker, the Prime Minister stood at the dispatch box yesterday and apologised, and he set that out, I think, very clearly from this dispatch box. And as he said, and I think as most people have expected, it is right to wait for the completion of the investigation by Sue Gray.
Greg Clark.
Thank you very much indeed, Mr Deputy Speaker. I join the Secretary of State in his tribute to Professor Jonathan Van-Tam for his remarkable public service, and I welcome the announcements that he's made today. Restrictions have an impact beyond COVID, as we know, and we should be as responsive in lifting them as we are in imposing them. So given the news that he's given us today, that over 91% of over 50s have been boosted, can he confirm that we are on track to lift the Plan B restrictions when they expire on the 26th of January? And would he include in that the advice on face masks in classrooms for which a particularly weak evidence base was published.
Secretary of State.
Yep. Mr. Deputy Speaker, first of all, can I thank my right honourable friend for his support of these new measures. And I know he speaks with considerable experience. He's absolutely right, first of all, to talk about the impact of restrictions beyond health. He's absolutely right to talk about that. And he has heard me say before, other members of the government say before, that no restriction, none at all, should be in place for a moment longer than is absolutely necessary. My right honourable friend will know that the restrictions, the Plan B restrictions, are planned to, unless this House was to decide otherwise, they would sunset on January the 26th. But in terms of what happens next, in terms of the government's own view, we will set that out as soon as we can.
Meg Hillier.
Thank you, Mr. Deputy Speaker. Mr. Deputy Speaker, the Secretary of State talks about the importance of having insurance policies, and if you're managing risk as he is, of course that is the proper thing to do. However, on Friday, the Secretary of State issued a ministerial direction to the NHS England Chief Executive Amanda Pritchard to authorise the use, as he's touched on in his statement, of private sector providers. This is at a very high cost. It requires a minimum income guarantee for those private hospitals of between 75 million and 90 million a month. And if the surge requirement is used, that could rise to £175 million a month, as the Chief Executive sets out in her letter requesting the direction. Could the Secretary of State explain where that money is going to come from and why, at this stage of the pandemic, we're still being held over a barrel as the taxpayer by the private sector? Could he not have negotiated at least a better deal?
Secretary of State.
Well, Mr. Deputy Speaker, first of all, the deal the Honourable Lady refers to, that was negotiated by the NHS, and I think they've done an excellent job in their negotiations. It's also absolutely right for the Chief Executive for the NHS to write to the government, to write to me, and to request such a direction, because the NHS's job is obviously running the NHS, but the government's job is also to think beyond the NHS and the impact of COVID beyond just health. And the Honourable Lady should know by now that the more capacity that we've got in the NHS, the less the need there is for restrictions. And what I can tell you for sure, Mr. Deputy Speaker, had we not taken out this insurance policy with the independent sector and got this extra capacity, that she would be one of the first standing up here in this House asking us why we didn't work with the independent sector.
David Johnston.
Thank you very much, Mr. Deputy Speaker. Can I welcome my right honourable friend's statement about reducing the self-isolation period? I have a number of constituents who haven't seen their relatives in care homes for considerable time, and I have a member of my own family who can have a visitor but has been confined to her small room for coming up 5 weeks now, because every time there's a case anywhere, everybody's kept in their rooms, can't go in the garden, can't go in the communal areas. Can I ask my right honourable friend to look at these guidelines again, because of course we want to protect care home residents, but the way they're being implemented is having a considerable impact on the physical and mental health of people in care homes.
Secretary of State.
Mr. Deputy Speaker, my honourable friend is absolutely right to raise this most important of issues, and in the way he's phrased the question, he reflects just how difficult it is to strike the right balance in care homes between protecting the residents of the care homes, but also making sure that they can get those visits that are so important for them. The approach that we've taken in England is different to other parts in the country. We do allow more visitors. We are supplying a record number of tests to care homes, both for the residents, but also for the staff in the care homes. And for the reasons that he has so clearly laid out, we keep this under review and will remove restrictions as soon as it is safe to do so.
Graham Morris.
Thank you, Mr. Deputy Speaker. In welcoming the Secretary of State's statement, I particularly welcome his reference to cancer patients and his commitment to apply the latest technology. May I respectfully draw the attention of the Secretary of State to yesterday's excellent debate in the Westminster Hall about access to radiotherapy services. And in particular, can I draw the Minister's attention to the fact that modern radiotherapy is extremely precise, cost-effective, and is non-invasive. It doesn't affect the immune system. And can I urge the Secretary of State to provide the required additional resources needed to modernise radiotherapy services throughout the UK and to catch up with cancer?
Mr Deputy Speaker, I do very much agree with what the Honourable Gentleman has shared with the House. I myself, I was not unfortunately able to attend that particular debate, but I know the Minister did, and I know the Minister will be also meeting with the APPG on radiotherapy as well, and listening more. But I know the Honourable Gentleman agrees with me. It's been also absolutely right during this very difficult time for the NHS, especially as it's had to direct more resources to looking after more COVID patients and getting the booster programme, but it's also been right to protect cancer care.
Pauline Latham.
As the world improves with the vaccine programme that we have had and continue to have, which has been brilliant in this country, could I ask the Secretary of State to urge doctors who are not on the front line with COVID to actually see their patients face to face again, because doctors in hospital and GPs are still not doing this fully, and people's problems are being missed. There is also a problem, as the world opens up, that if you've had COVID and you need to travel, you cannot do a PCR test because that shows that you're positive, even though you've long since left, you're not positive for COVID anymore, but it still shows a positive test on a PCR. And also, you cannot prove to a country you're going to, and many people are wanting to travel more now, that you've had COVID. And so you're actually stuck for 90 days where you can't go anywhere out of this country if that country requires a negative PCR test, because you can't get one.
First of all, Mr Deputy Speaker, can I agree with my honourable friend on the points that she's made about these issues, but on her final point about travelling, it is, as she has seen just in the last few days, the UK government keeps its travel rules under constant review. The moment we are able to safely remove any of those rules based on the evidence, we have done so. And I know my honourable friend has respected that. But when it comes to the rules of other countries for British citizens wishing to travel out, perhaps for holiday business or for otherwise, of course, those are their rules. But we are working at many levels, both my department, the Department of Transport and others, the Foreign Office, with those countries to see how we can best coordinate on such rules.
Lillian Greenwood.
Thank you, Mr Deputy Speaker. I'm delighted that JVT is returning to the University of Nottingham, but I'm worried about what he'll hear from local clinicians. This week I received an email from a doctor working in our local NHS. She says, "I'm crying as I write this. For years now, the talk has been that the NHS is at breaking point. Well, that point has passed. We are broken. We are on our knees." Of course, COVID has taken a huge toll on staff, but we went into the pandemic with huge waiting lists and chronic staff shortages, a direct result of underinvestment and mismanagement over the previous decade. Hasn't his party failed my constituent and her NHS colleagues?
Well, JVT, as I mentioned, Mr Deputy Speaker, earlier, it says the country's loss, but it is Nottingham's gain, and I'm glad that she's delighted. But in terms of investment in the NHS, the Honourable Lady will know that even before COVID-19, the government had already set out the long-term plan for investment in the NHS, some over that period, an extra 30 billion a year going into the NHS at the end of that period, with huge investment, whether in cancer care, in mental health care, in electives, and then during the crisis, which of course has been very challenging for our health and care services, as it has been across the world, over £40 billion of extra investment, including this year, to help us get through this crisis.
Mark Harper.
Thank you very much, Mr Deputy Speaker. Can I first of all welcome the change in the self-isolation rules that the Secretary of State set out. It's, I think, a good indication that the government is able to be flexible on policy. So let me have another go on the subject I raised yesterday, which he heard the exchange I had with the Vaccines Minister. She agreed with me from the dispatch box that persuasion was the best and right way to get health and social care workers to be vaccinated. But I have to say to the Secretary of State, telling a health and social care worker that if they don't get vaccinated, they're going to be sacked, isn't persuasion, it's coercion. So can I ask him to just reflect on whether it's sensible on the 1st of April to continue trying to implement a policy that the government's own estimates will see 73,000 NHS staff and 38,000 domiciliary care workers lose their jobs. When a policy isn't working, it's right to ditch it, isn't it?
Well, first of all, Mr. Deputy Speaker, can I commend my friend for the scrutiny that he has constantly provided of the government's COVID policy long before I was the Secretary of State, and I'm pleased to see that he's continued to provide that scrutiny. It is very valuable. It's most valuable to me when he supports the policy, like on isolation today, but it's still valuable when he challenges the government again to think again about policy. I think it's very, very important. On the particular policy he's raised, the vaccine as a condition of deployment in the health and social care sector, I did address it a bit in my statement earlier. He would have heard that we are committed to the policy, but we are committed to the policy because it is right that in those settings where there are people that are more vulnerable than others, that they are put first. And we know that vaccines do limit transmission. Vaccines limit transmission. And as a result of that, that means that the individuals that are providing that care, the health and care workers, it will be safer if they are vaccinated because of the limit to transmission for those patients than otherwise. This is about putting patients first, and this was a policy that was voted on by this House with an overwhelming majority, and the government intends to implement it.
Thank you very much, Mr. Deputy Speaker. The Secretary of State put a lot of emphasis on testing in his statement. Inspired Outsourcing in my constituency would agree with him. They provide contact centre services. Some of their workers are key workers and so cannot work from home. They have been using twice-weekly testing to keep their workers safe, but they have run out of tests. They can't get hold of any tests apart from by paying what would be effectively £2,000 per month to a private provider recommended on the government website. So can you say to me very specifically whether small businesses like Inspired Outsourcing should have access to free lateral flow tests and how they can get hold of those tests today in Newcastle, because that is what they need to keep their workers safe and provide protection to all of us?
Yeah. It's an important point, Mr. Deputy Speaker. And when the country first discovered Omicron, of course, the tests that were in stock at the time weren't designed for another huge wave. But the testing, the people that run testing at UKHSA, they responded very quickly by ordering almost any lateral flow test that meet our standards that they could find. And as I said earlier in my statement, in December, we had 300 million as opposed to, I think, around 100 million that was originally planned. And in January, there will be 4 times the pre-planned amount. In answer to her specific question, for people, whether it's for a workplace or for visiting a care home or whatever it is, they will be able to get access to the lateral flow tests now that millions more have arrived in the country. They've been distributed and they can get them online or they can get them through pharmacies.
Peter Baird. Thank you very much, Deputy Speaker, and I'm very grateful for the excellent Minister coming to the dispatch box yet again to update the House, and particularly to make an announcement first in the House rather than to the media. I wonder whether the Secretary of State would agree with Lord Frost, who said, "I'd like to see the government ruling out lockdowns for the future, repealing the legislation, ending them now. We can't afford it and it doesn't work. Stop doing COVID theatre, vaccine passports, masks, stuff that doesn't work."
Mr. Deputy Speaker, I have huge respect for Lord Frost and also for my honourable friend. And I think for what my honourable friend has just shared with us, these are very important points. No one wants to see this country go back into anything that resembles a lockdown. As my friend would have, my honourable friend would have heard earlier, that yes, we've had some restrictions, of course, put in place, the so-called Plan B over the last few weeks. But I hope he would agree with me that even when we reflect on those restrictions and compare them to other countries in Europe, large or small, we are the freest country in Europe. And the reason for that is because of the pharmaceutical defences that I talked about earlier, the most boosted large country in Europe, the most antivirals per head, the most tested, and that is what we should be focusing on for the future as we learn to live with COVID.
Dame Diana Johnson.
Mr Deputy Speaker, I just want to press the Secretary of State on the morale of our NHS and social care workforce. Between March 2020 and May 2021, he will know that 1,561 NHS and social care staff died from COVID whilst working on the front line. And it's part of the reason why I'm campaigning for an NHS and social care covenant, just as we have for the armed forces and the police. But what does the Secretary of State have to say to those key workers who saw colleagues die while the Prime Minister was at the law-breaking works party on May the 20th?
I mean, the Honourable Lady is absolutely right to raise the importance of morale in the NHS, and I know, like me and every member of this House, she will know full well the huge debt this country owes to everyone that's worked in the NHS and the care sector, especially over the last 2 years. And she's talked about campaigning for a NHS covenant. I'm not sure how much longer she needs to campaign, because I've already announced that we're going to have one. I'll be happy to work with her about how we could do that, but she can desist on her campaign and put her efforts into working with me to actually help introduce one. She will know that as Home Secretary, I decided that the police should also have a covenant, and so it is right that we do recognise the NHS in this way too. As for the point she made about the Prime Minister, I'll refer to the answer I gave a moment ago.
Alicia Cairns.
Mr Deputy Speaker, as my right honourable friend knows, despite my enormous respect for him, I did vote against the introduction of COVID passports before Christmas. I maintain my view that they are not effective. So will he please commit to dropping domestic certification at the earliest possible opportunity? And will he also today, from the dispatch box, make clear to NHS Trust up or down this country that he will not stand for the pandemic of arbitrary discrimination we are seeing against pregnant women and their partners and parents who want to be with their children on paediatric wards but are being stopped by NHS Trust in an illogical and unscientific manner from being with them to look after them and advocate for them.
I mean, first of all, Mr Deputy Speaker, I agree with my honourable friend absolutely on what she has said about pregnant women and with every word that she has just said, and that is a message that has been reinforced to every NHS trust, and I thank her for how she has campaigned on this issue and brought it to light, because it is making a difference. On the issue that she also raised around the domestic certification, I have to say I do share my honourable friend's instinctive discomfort. So I want to assure her, I will assure her at the House, that as far as I'm concerned, that we won't be keeping domestic certification in place for a moment longer than absolutely necessary.
Vera Hophouse.
Thank you, Mr Deputy Speaker, and may I, from the Liberal Democrat benches, also pay tribute to the services of Professor Sir Jonathan Van-Tam. Mr Deputy Speaker, the government is still ignoring people who are clinically extremely vulnerable, and their concerns and the lack of guidance and support. I have raised this with the Secretary of State before Christmas, and I still have many of my Bath constituents writing in about this. 2/3 of housebound people have not received the booster. So what is the government doing to make sure that the vaccines are accessible to everybody, including the housebound?
Mr Deputy Speaker, of course the Honourable Lady, when she talks about making sure everyone gets access to the booster, the people at the top of the list should be those that are clinically extremely vulnerable, as long as the vaccine is something that can work for them. And that is why during the month of December, especially when we have accelerated the booster programme, working with GPs mainly, but also others, that those that are housebound or in care homes have been a priority, and we have seen the booster rate rise substantially. And also, can I point her to what I said in my statement earlier about the 1.3 million clinically extremely vulnerable that we have also contacted, the NHS has contacted directly to make sure that they have access to the new antivirals that we have procured, which I'm sure that is something that she would welcome.
Marco Longhi.
Thank you, Mr Speaker. Can I thank the Secretary of State for the statement he's brought forward with such positive news that will bring confidence to individuals and businesses as they want to go back and return to a more normal life as we learn to live with COVID. My constituency of Dudley North actually has many, perhaps a higher proportion of small self-employed businesses, and they were absolutely terrified in the run-up to Christmas that we were looking at lockdowns and severe restrictions. So can I thank him and the Prime Minister for the balanced and proportionate approach that the government has taken in looking at how we move forward and steps that it took during the Christmas period, and can I seek assurances that this will continue to be the way?
Can I first thank my honourable friend for his comments and support of the changes that I have announced today. And he's right to point to a key difference in our approach during this Omicron wave compared to any other country in Europe, I think any other large country. It is not by accident that we have been the most open, the most freest in Europe. It is by design. It is because we have rightly focused on the booster program, with 79% of eligible adults boosted, the most boosted country in Europe. We have more antivirals per head than any other country in Europe. We are testing more than any other country in Europe. It is these pharmaceutical defences that will allow us to live with COVID, to keep businesses open, to protect the life chances of our young people, and to keep our country open and free, just the way he wants to see.
Daddy. Deputy Speaker, I'm sure the Secretary of State will want to join me in paying tribute to the staff at Cardiff and Vale Health Board for their work on the booster programme. And you'll know today that the statistics show that, in fact, Wales is joint first in Europe, actually ahead of the UK average on delivery of boosters, and that can only be a good thing for our population. But will he say a little bit about what the JCVI is discussing and what his views are on further boosters, indeed for people who are older and more vulnerable, the immunosuppressed, the use of polyvalent vaccines going forward? Because obviously, as we open up further, and there are people who are going to be deeply worried about that, particularly with waning boosters. So will you say a little bit about the plans for further jabs for those most vulnerable?
Yeah, well, first, Mr Deputy Speaker, I would join him in commending Wales in their rollout of their booster programme. And in fact, throughout the UK, in Scotland and Northern Ireland, in every part of the UK, we've seen a very good, positive approach, protecting more and more people. In terms of the JCVI, I will point to the Honourable Gentleman to two more recent announcements that he may or may not already be aware of. There was one just before, I believe, the Christmas break, where the JCVI recommended to the government that at-risk 5 to 11-year-olds are offered the paediatric vaccine, and we have accepted that. I have accepted that, and that will start this month, and I believe that will start across the UK, so including Wales. And the second recommendation we received very recently, I think it was just at the end of last week, was that after carefully looking at the very latest evidence, some of the evidence I referenced earlier from UK HSA when I made my statement, the JCVI decided that we should not offer a fourth dose to over 85s or others at risk at this point, because they were comfortable that the protection that is provided, and when they looked at waning, was still incredibly strong for older people.
Thank you, Mr Deputy Speaker. Can I add to the chorus of approval for the decision to reduce self-isolation to 5 days? But can my right honourable friend ensure that the NHS COVID-19 app and the government website is updated as soon as possible to avoid confusion which seemed to exist around this reduction to 7-day isolation, to ensure that people fully understand their obligations and when their isolation starts and when it can finish?
Yeah, Mr Deputy Speaker, first can I thank my honourable friend for his support, and also I will make sure that the website is updated in the way that he says as soon as possible.
Holly Lynch.
Thank you very much, Mr Deputy Speaker. Recent data suggested that just 4% of teachers said that they had readings on classroom carbon dioxide monitors which are above the safe threshold set by the Department for Education. He will be aware that ventilation is becoming a massive challenge in schools, and in primary schools in particular. So can I ask the Health Secretary, what conversations is he having with his colleagues at the DfE to make sure that children can be in classrooms, can continue to learn, but do so safely as possible, protecting them and the wider community?
It's an important issue raised by the Honourable Lady to make sure that we're doing all we can as a government to work with schools to protect school children so they can stay in school. No one wants to see what's happened before with the lockdowns and children not being able to attend school in the usual way. That's why I hope that she would have welcomed the recent announcement by my honourable friend, the Education Secretary, on a huge new investment in ventilation. And I know that my right honourable friend, the Education Secretary, is taking this issue incredibly seriously, working with schools up and down the country and seeing what more can be done.
Mr. Baker. Deputy Speaker, implicit in my right honourable friend's statement was the concept that we'll all be held back by the decisions of the unvaccinated. And if I may say so, he used some quite heavy language to bring pressure to bear on the unvaccinated, talking about standing on people's shoulders and so on. Can I just say to him that wouldn't it be better, rather than creating what does seem to me to be the conditions for coercion and division, it might be better to say to the unvaccinated, you've made your choice to take a greater risk, and we are not going to be held back as a society by your choices. You will have to bear the consequences. Wouldn't that be a more consistent and humane way to deal with them and to deal with us all without creating division?
Well, I mean, first of all, actually, can I also take this opportunity to thank my honourable friend for the scrutiny he provides as well. And as always, he makes important points that are worth discussing. And on this particular point, he's right that about the language that I used earlier, because it is factually correct. The reason why this country is as free as it is now is because of the decision that 9 out of 10 people have made to get vaccinated. Those people who made a decision when they could have been vaccinated because they're not medically exempt, for example, but they could have, they've chosen not to do that. And that has consequences. It doesn't just have consequences for them, it has consequences for all of us. My honourable friend might be interested to know that when I visited a hospital last week, King's College Hospital in London, that I was told by the consultant in charge when I went to the ICU ward that was looking after COVID patients, I was told that they estimate that 70% of those in the ICU ward were unvaccinated. 70% were unvaccinated. If those people had got vaccinated, they not only would have been safer, but it would have meant that that space in hospitals could have been used for others. And if that is not just in ICU wards, if you look at the 17,000 COVID-positive patients in our hospitals, this is something that could have been prevented had those that were unvaccinated or decided not to take their booster shot had actually bothered to do so. So yes, getting vaccinated, it needs to be a positive choice. We need to encourage people, and with the exception of the health and social care high-risk settings, it should not be done by compulsion. I don't believe in that. I don't think it will work. I think it's unethical to do so. But the people who have chosen not to get vaccinated should understand the consequences of their decision for the rest of society.
Clive Efford.
Thank you, Mr. Deputy Speaker. Following on from that, paying tribute to all NHS and care staff, we are 17 days away from the first deadline when NHS and care staff will need to get their first vaccine if they're to be vaccinated by the deadline of the 1st of April. What we didn't hear in the Secretary of State's statement is anything about a long-term strategy for staffing in our NHS to deal with the current vacancies and unfortunately those that will come about as a result of the 1st of April deadline. So where is the long-term plan that managers in the NHS are crying out for, and where are we going to get qualified staff from in the future?
Well, I hope the honourable gentleman heard some of the comments I made earlier about the importance of making sure patients are as safe as possible in health and care settings, and I hope that he agrees with that and therefore understands the new vaccination rules, that he's referred to the importance of those rules. But he is right to ask about the planning that is necessary to cope with those changes, and I can reassure him that since that decision was made, in fact even before Parliament had voted in anticipation of such a decision being made by Parliament, the NHS had started planning for this. They are working with each and every trust, but the most effort that they are putting in, I think rightly, is to convince those, I think 6% of people in NHS trusts that have, those so far, not had a first dose of the COVID-19 vaccine, to convince them in a positive way to make that positive choice with all the information that they need about the vaccines being safe and effective, offering them meetings with clinicians, including one-on-one meetings, and I hope the honourable gentleman supports that kind of approach.
Thank you, Mr. Deputy Speaker. I very much welcome the reduction in self-isolation times to 5 days. That will be appreciated by the hospitality industry, particularly in Bournemouth. Mr. Deputy Speaker, I'm proud to say that I'm a vaccinator in Bournemouth, and tomorrow will be doing my duty along with thousands of others across the country. It is a critical job and a rewarding one if we are to tackle COVID-19. He'll be aware from his visits that the atmospheres in these temporary hubs is extremely professional, but it can also be quite quiet and sombre. Could I ask the Secretary of State whether he could look at seeing if the licensing conditions for radio could be lifted? Maybe he could speak to the BBC, Classic FM, Virgin Radio. Chris Evans might even be listening to our debates here even today. I hope that he would agree that it would help lift spirits as we go about this important national effort.
Well, first of all, can I thank my honourable friend for his support for today's measures, but can I also thank him for being a volunteer vaccinator? It is people like him up and down the country, but especially in the last few weeks as we made the call for the booster programme that have come forward in their thousands, and they are the people, these volunteers, working alongside the NHS, also, may I add, alongside the soldiers and the military that have helped with something else I know that my honourable friend has experience of, a direct experience of as well. I've listened carefully to his suggestion, and I think that's a very good suggestion. It's not something I had given thought to before, but I think it is absolutely right that we contact these organisations and see if they would like to be helpful in helping our army of vaccinators across the country. So it's a very good suggestion. I thank him for it, and we shall try our best to act on it.
The incredibly patient Matt Weston.
Thank you, Mr. Deputy Speaker. I just want to add my voice to the congratulations to Jonathan Van-Tam, but also to all those across our universities and science sectors who contributed so much at this time, and I hope others will get rewarded similarly. Secretary of State's aware, of course, of the shortage of testing kits. He mentioned it in his statement. 120 million now increased to 300 million. On these benches, as my right honourable friend was saying, we're desperately keen that business should stay open and that young people should remain in education. Now, I'm aware, of course, that there are separate supply lines for testing to universities, but there is concern, actually, about future weeks' supply. Can the Secretary of State confirm, guarantee, perhaps, that there will be no issue in the coming weeks about the supply of testing kits to our sector, our higher education sector?
Well, first of all, Mr. Deputy Speaker, I think the honourable gentleman is absolutely right in the way that he has thanked not just JVT for his service, but also those across our academic sector that have supported the government, supported people, supported the NHS throughout this pandemic. I'm privileged to work with so many of them, not just with JVT, but I can see every day the value they add and how they are helping us all to get through this pandemic. He's right to raise the issue of testing. It's not to 300 million. 300 million in terms of lateral flow tests was December. For the month of January, we have planned at least 400 million. That's 4 times the original pre-Omicron plan. That makes us confident that we have the lateral flow tests that we need. But in terms of, to be more specific, in terms of the university sector and more broadly the education sector, including schools and colleges, they rightly have a separate supply line that is still run through my department, but we work very closely with the Department for Education to make sure that that sector has the supply that it needs.
I'd like to thank the Secretary of State for his statement and responding to questions for an hour. Point of order, Sir Ian Duncan-Smith.
Mr. Deputy Speaker, I rise on a point of order literally as an email from the Speaker has arrived in our offices. The key issue here is that I understand that Mr. Speaker has been contacted by MI5 and is now warning members of Parliament that there has been an agent of the Chinese government active here in Parliament working with a member of Parliament, obviously to subvert the processes here. I say, as a Member of Parliament who is sanctioned by the Chinese government, as others, that this is a matter of grave concern, and I therefore rise on 3 points which are really important. Number one, will this now lead to a serious overhaul of the accreditation procedures here in the House of Commons? Because it's clearly too slack that these people get in, either in APPGs or with individuals. Is it possible that we will have a statement from the Speaker, from the Chair, about the risks? I am one of those who has done a lot to try and help fleeing Hong Kong Chinese, fleeing the communist regime here in the UK. We have names and numbers of people, and that leaves me worrying that some of these have been accessed by such an individual. These would be their lives and their families at risk, and I am deeply concerned about this because my activities, therefore, may well have been traced as those as well from my colleagues and friends. And I understand that the latest news that I hear is that this individual is not to be deported and no further action to be taken. How can it be, Mr. Deputy Speaker, that an agent of a foreign despotic and despicable power that is hell-bent on reducing many of those people into penury, it seems, how can they put somebody into Parliament, as Mother of Parliaments, and then that individual have nothing done to them other than they're not allowed in Parliament? This is surely not good enough. And could there be a statement from the government as to what they plan to do, and possibly, with respect, of course, from the Chair and Mr. Speaker?
I'd like to thank the Right Honourable Member for his point of order and giving me forward notice of it. As you know, it's not the policy of the Chair to comment in detail on any security matters, and I will certainly not be doing so today. As far as any statement either from the Chair or indeed from a government minister, I've been given no notification whatsoever that that is happening, but should that change, then I'm certain that members will be notified in the usual way. And as far as the third point, as I said, we don't discuss the detail of security issues on the floor. However, I can assure the Right Honourable Member that the House authorities are in regular contact with the appropriate government agencies on this matter, and we will update our advice and activities as necessary. Jim Shannon, further to that point of order.
Further to that point of order, first of all, thank the Honourable Gentleman for bringing it forward. It is such danger and concern for us in this House. I'm just wondering, Mr. Deputy Speaker, whether you've had the opportunity to find out if this knowledge of the integration of a Chinese spy in this House has been conveyed to other administrations in the United Kingdom and in actual fact to the Northern Ireland Assembly, because when it comes to accepting those from Hong Kong that the Honourable Gentleman referred to, Northern Ireland will be one of those as well. So we want to make sure that the people are safe, and with that in mind, has yourself, Mr. Deputy Speaker, or the House been made aware that the Northern Ireland Assembly, for instance, has been made aware of this? Thank you.
I'd like to thank the Honourable Member for his point of order. Devolved administrations and the government. Further to the point of order, Tobias Elwood.
Thank you, Mr. Deputy Speaker. This is the sort of grey zone interference we now anticipate and expect from China. But the fact that it's happened to this Parliament, there must be a sense of urgency from this government. I'm grateful that you yourself in your comments here today have taken this very, very seriously indeed. But could I encourage and endorse the request for a statement on this before end of play today, so we can understand the ramifications, the impact of this, and what the government and indeed Parliament intends to do about it?
I'd like to thank the Right Honourable Member for his point of order. There again, the Treasury bench will have heard what he has had to say, and as I said earlier on, should a statement be made, then the House will be informed in the usual manner. I know that all Right Honourable and Honourable Members will be very concerned by the contents of the email, and as I say, the Treasury bench, I'm sure, will pass on the comments that she has heard today to the relevant ministers. I'm now going to hand over to Dame Eleanor Lang, who will now proceed to take the next business.